Today we have with us Dr. Nikita Trehan. She's a gynecologist and laparoscopic surgeon, and also she's a managing director in Sunrise Hospitals, and also she's the managing partner of IMH Hospitals. Doctor, could you please tell us what's the role of laparoscopic in gynecology?
Laparoscopy is something which is totally changed the face of medicine today. In every branch of medicine, we need laparoscopy. So whether it's gynecology, whether it's oncology, whether it's general surgery, everywhere today surgery has to be done by laparoscopy. Now in gynecology, women play a key role in the house, at their job. So once they do not have the luxury of falling sick is what I say usually. So they need to get back to work or they need to get back to their families within a day or two. And laparoscopy has all those benefits of getting well fast, and all the diseases which could be treated by open surgery previously are now being handled by laparoscopy. So whether it's any size fibroid, whether it's a hysterectomy, whether it's a cancer surgery, today we do everything by gyne laparoscopy.
Doctor, how's laparoscopic surgery is more beneficial than the open surgery?
Laparoscopy basically has multiple benefits over open surgery. In fact, we do not do any open surgery now. So whatever could have been done by open surgery is now done by laparoscopy. It offers only 1 day the patient has to stay in the hospital. It is a 1 centimeter cut through which a telescope is put inside the abdomen or any body cavity of the patient. So once we're putting it as gynecologists, we're putting it in the abdomen, so everything can be seen clearly. Since there is very minimal blood loss because the picture is magnified 20 times, so the patient doesn't lose much on blood. So even in anemic women, it can be done very easily. Also, it's very well lit because we use a very powerful xenon light source. So everything is well lit, well seen, and it's a far superior surgery. We are not doing it for cosmesis. We are doing laparoscopy because it's a far superior surgery. Also, because there's very little damage to the adjacent organs around, there are less chances of organs sticking together and adhesions are not formed, so patient is much more comfortable. Post-operatively, pain is less. Pain scores after an open surgery are 8 to 9 out of 10 compared to laparoscopy where it's only 2 to 3 out of 10. Also, the woman can go back home the next day and can join work within 4 to 5 days. That is on the average patient. And after an open surgery, patient has to be in the hospital for a week and can only join work after maybe 3 weeks or 4 weeks. So there are huge benefits for the patient, for the patient's family, and for the entire society at large out of a laparoscopy.
Doctor, is there any specific situation when you have to do open surgeries instead of laparoscopy?
Actually, it all depends on the skill of the person who is doing the surgery. We do not have any indication left where we have to do open surgery because any size of the uterus, because these are the most common contraindications amongst doctors. They say, oh, you've had a previous surgery or you've had previous cesarean sections, hence you cannot do a laparoscopy. Nothing of that kind. With experience, I personally have operated on previous 8, previous 10 cesareans also. It's not a problem. Then there's another myth which is attached to laparoscopy that, oh, you cannot do it if the uterus is very large. We have the Guinness record for the world's largest fibroid removed laparoscopically, which was 3.9 kg. So everything is subjective. But whenever we do a case, we have to see the risks and the benefits of a procedure. We never say no for anything. We have a patient-centric approach where the patient is most important, and whatever is absolutely good for the patient is what we do. So, laparoscopy is the gold standard today. We know that everything can be done by laparoscopy. Yeah. If you cannot do it by laparoscopy, then refer to someone who can. Do not do open surgery. So we have very good referring systems. We have a very good protocol now, which is in place. I don't think open surgery is there anymore, other than ovarian cancer. Because even cervical cancer, even other cancers, we are doing by laparoscopy now.
Yeah. Doctor, what is fertility enhancing laparoscopic surgery?
Basically, nowadays what is happening is people are delaying their age of marriage a lot. And because the careers or any other social factors which is putting a pressure, so people are getting pregnant or starting a family much later than they were earlier. Yeah. And with an increase in age, we are finding that they do not get pregnant as easily. So infertility has become a huge thing now. And amongst the women, we have fertility enhancing surgery. So whatever causes are there in the uterus, in the tubes or in the ovaries, they can be handled laparoscopically. So suppose there is a fibroid. Fibroids are benign growths in the muscle layer of the uterus, or there is endometriosis where organs are stuck together, or there is tubes are stuck, or tubes are blocked because of previous infections, or the ovaries have a cyst, or if they have PCOD, everything can be handled by laparoscopy. So it's like cleaning a field before you put a seed. So by laparoscopy, we clean the entire uterus, tubes, ovaries, and then we tell them to have a baby and then get pregnant. So then they have a healthier baby, the miscarriage rate is lower, and of course the entire process is much more simplified.
Dr. Nikita, please tell us also, is IVF required frequently as much as it's being done nowadays?
Now, actually, IVF, I would say, is the last resort. You know, when a couple is not able to have a pregnancy normally by themselves or by IUI, then we go for fertility enhancing methods, assisted reproduction or IVF, in vitro fertilization, or test tube baby as it is commonly known. But there's so many conditions which can be handled, which can be treated. So what happens is that you cure the root cause. So suppose the tubes are blocked, you open the tubes out. She doesn't need IVF per cycle. It's not that each time there will be IVF or test tube baby being made for each pregnancy. So she can have as many children as she wants to with one fertility enhancing surgery, rather than going on and on and on doing all this. IVF, as we know, is a very painful and very mind-boggling procedure where the success rates on an average worldwide are 40 to 50%. And each cycle is a lot of emotional turmoil for the patient and their partner. So obviously, why not do something which is natural? Natural processes, natural way, fertility enhancing, where you open the tubes, you cut a septum which is present inside the uterine cavity, or whatever defects are there, by hysteroscopy or by laparoscopy, you correct everything. So then the need for IVF comes down to less than 10%, which is currently almost the reverse. Almost everybody is going for IVF nowadays. Okay, we're not having a baby, we've tried for a year, now let's go for IVF. No, there are other much simpler methods. Please follow them first and then jump into IVF.
And now let's move to fibroids. What is it exactly?
Fibroids are basically benign tumors present in the muscle layer of the uterus. So as they become bigger, they grow inside the cavity of the uterus or they grow outside. So these fibroids can actually cause multiple problems. If they grow inside the uterus, they can cause heavy bleeding, menorrhagia as we call it in our language, and prolonged periods lasting for 8-10 days, basically menstrual disturbances. If they are outside, they can compress organs, so they can press on the bladder and cause a lot of pressure symptoms where the woman has to go to the loo ever so often. Or in unmarried girls, we find the sheer size of the fibroid, because you'll find a big tummy, and you know it's socially very embarrassing for an unmarried girl to roam around with a big tummy where she looks pregnant. And sometimes we've even seen patients who are completely asymptomatic, and the two tubes which carry urine from the kidney to the bladder, the ureters, are pressed by these fibroids, and then it leads to kidney damage. So fibroids are way too common than were thought earlier. Also, we find the incidence in UAE, in the African countries, and in some of the Caucasian countries very high. And what is the basic thing for it is that it has to be handled surgically. You have to take it out surgically. And infertility is one reason why they present ever so often. So we do take it out, and in unmarried girls in UAE, they come with heavy bleeding or with compression symptoms. So, I mean, any size of fibroid, I mean, we've taken out up to 3.9 kg size of fibroid laparoscopically. Any size of fibroid can be handled by laparoscopy. Also, I'd like to tell you additionally of a procedure which we do at our group, which is Sunrise Group and IMH.
Yes.
We do a procedure called LUAL, laparoscopic uterine artery ligation at origin. This procedure is an additional procedure done along at the time when we are taking out the fibroid. So the extra blood supply to the uterus or to the fibroids is stopped. So the recurrence of fibroids is stopped. or at least reduced to by 90%. So only 10% women will have a recurrence. 90% after lual do not get a recurrence.
Yeah.
Because the basic problem with fibroids is you take it out today, again after 2 years there will be another fibroid coming out. To combat that, we came up with lual, and it has really done wonders now.
What is the reason behind the fibroids? And you just mentioned that it's really common in Africa and in our countries. What's the reason behind that?
See, basically there is a genetic cause behind fibroids. Basically, if you are genetically predisposed, like we find that the black race is extremely predisposed to fibroids, in such women, and in UAE now also, they are getting more predisposed. Also, they do not get married on time. If a woman gets married on time and has a babies on time, then there is no problem. Then the fibroids do not come back so often. But if the marriage is delayed, like 35, 40, we find for social reasons that people are getting married really late, having their babies late. So then the fibroids come back again and again. So it's the hyperestrogenism, the extra estrogen which is secreted from their body on a predisposed person, which causes these fibroids.
So it's just as a precaution to do is just get married early and
Yes.
have children early.
Yes.
What is endometriosis?
Endometriosis is a condition in which the inner lining of the uterus, which is supposed to shed out as your period, goes inside. Again, it's a genetic problem where it goes inside and it makes the organs stick together. So with endometriosis, typically, depending on the age, we find the typical triad of symptoms where she has very painful periods. So in your young daughters, girls, where you find that they are totally incapacitating, they can't go to school or they can't go to work, incapacitating their day-to-day life. It's a big symptom of endometriosis. Do not ignore it. Or if there are sexual problems, I mean, every time she has sex, if there is a lot of pain, that is dyspareunia is another big thing of endometriosis, a big symptom of endometriosis. And infertility. And in endometriosis, infertility is extremely common. So with this triad, we come to know with these symptoms that yes, the patient is suffering from endometriosis or not. And we have special treatments at IMED. We have something called sandwich therapy. I know previously we were just eating sandwiches, now we are giving the treatment sandwich therapy, wherein we do a primary laparoscopy, clean out all the endometriosis, all the organs which are stuck together, all the bad blood, all which is lying inside, everything is cleaned out totally. And then we give them 6 months of hormones and then do a relook laparoscopy. We find that in infertility patients, after one laparoscopy, their success rate or take-home baby rate, as we call it in our language, or whether they'll realistically be able to have a baby, is 20%. Vis-a-vis sandwich therapy, where their success rate is about 80%. So it's come as a big boon. And along with this, infertility is something which we treat regularly with endometriosis, but the period pain and in unmarried girls is a completely different line of management, a completely different treatment, wherein again we do a laparoscopy, clean everything out, and then give them suppressive therapy, give them either DMP injections or birth control pills for non-contraceptive benefits. It's not for contraception that we are giving it to the girls, we are giving it for the hormone supplementation to keep everything calm, to keep everything quiet, so that when they get married, they do not face fertility issues.
We heard that you have a special treatment for miscarriage. What is it exactly?
Actually, miscarriages are something which we are completely emotional about. It's a really harrowing experience for any woman who is so joyous that she's pregnant when she has a miscarriage. It's actually very, very, very disheartening, and the complete family goes through hell. So we've had patients who've come with several recurrent miscarriages, or they've had 5, 10, the last one was 19 miscarriages. So that devastates a woman. So for that, we have a special miscarriage clinic wherein we investigate if there is anything wrong in their blood, in them or their partner, their husband, where it may not be causing a problem in them, but may be causing a problem in the progeny in terms of their genetics, or if there are any infections, or most importantly, if there are anything inside the cavity of the uterus. We do a hysteroscopy. A pen-sized scope is put inside the cavity of the uterus, and many times we find a wall which is dividing the uterus inside into 2 halves, which is called a septum. So we cut that wall out in the same sitting. Or there is a small growth or a polyp which is there, small benign growths. We take all that out and flush it out totally. Also, one big thing which has come by Sunrise Group now recently, and we've done it and we've got fantastic results with it, is laparoscopic encerclage. Basically what used to happen is in second trimester miscarriages means after 12 weeks of pregnancy, if there is a miscarriage which is happening, it's because the mouth of the uterus, which is only supposed to open at the time of the delivery of the baby, if it opens before time, then whatever is there inside the cavity of the uterus just falls out. So that is called cervical incompetence or incompetent cervix. So now, earlier on, the treatment was through the vagina, we used to put a stitch, but many women that fails. In fact, most of the time it fails. So now we have a laparoscopic treatment where the stitch is put laparoscopically, so it's put much higher. So the chances of miscarriage after we've sealed the door which can open before time. In short, in non-medical language, there is a door which is only supposed to open to let the baby exit. Suppose there is cervical incompetence, this door is opening before the baby is ready to come out. Now what we do with this laparoscopic encerclages, we seal the door only. So the baby has to come out via cesarean. There is no way they can come out. We've had very, very, very good results with laparoscopic encerclage. In fact, our lady who had 19 miscarriages, another who had 11 miscarriages, and several others have gone home happily with healthy babies at term.
Doctor, what are the consequences that the woman might face if she didn't visit a gynecologist on time?
There are a number of conditions where women are shy, they do not come, and if they do not come, like pap smear, it's so important to have regular pap smear, which is cervical cancer screening, so that we know early on that if there's going to be a cancer or there's going to be a problem, and treat it adequately. If there is incontinence, I mean, there are women who, when they cough or they laugh or they sneeze, they leak a little urine. Is it normal? Is it not normal? That is when you have to come to a gynecologist. I know women who are wearing pads, who are stinking, who have zero life with their husbands and who do not shy out, they do not go anywhere because they are too shy to come to a doctor. I mean, when you have a problem like that, if you are leaking when you're coughing or sneezing, see a doctor. All it'll take is a tape to be put inside the OT for 5 minutes, which is called a TVT tape. And it is a really simple procedure and your life will change. In today's world, we do not talk about quantity of life, we talk about quality of life. So what is your quality of life if you're going to leak and be embarrassed? Again, breast cancer, why has it gone to such advanced cases? Because women are scared to talk about it, to talk about breast diseases, to do a self-breast exam, to go for a mammography. All these awareness, it's our duty as doctors and your duty as media people to spread the awareness regarding these conditions. So your pap smear as a woman should be on time, your mammographies should be on time, you should eat healthy, be healthy, get married on time, have your children on time. So all these things will make you have a better quality of life. And any bleeding which you find abnormal, suppose you find that you're bleeding heavier than you were earlier, please visit a doctor. It may be a sign of a fibroid or endometriosis or even of a cancer. So do not neglect your own self because a stitch in time saves 9.
Thank you, Dr. Nikita Trehan, for sharing with us all of this useful information. Thank you for watching us in Dr. Insight. Thank you.
Oh,